Today, we're going to talk about a common issue that many dog owners face: lick granuloma. Lick granuloma, also known as acral lick dermatitis, is a self-inflicted skin condition where dogs excessively lick and chew a specific area, usually on their limbs. There are various reasons behind this behavior, including allergies, boredom, anxiety, or pain. It's crucial to identify the root cause to effectively address the issue. Some common symptoms of lick granuloma include hair loss, redness, swelling, and open sores. If you notice any of these signs in your dog, it's time to take action. Your vet can diagnose lick granuloma through a physical examination, and in some cases, he might recommend skin biopsies or tests to rule out underlying health issues. There are several ways to treat lick granuloma, such as behavioral modifications, medication, or even surgery in severe cases. Your veterinarian will help determine the best approach for your dog. Prevention is always better than cure. I'll share some strategies to prevent lick granuloma in the first place, such as providing mental and physical stimulation, managing allergies, and addressing anxiety. Lick granuloma is a common issue among dogs, but with the right diagnosis and treatment, your furry friend can lead a happy, healthy life.